Hi, everybody. My name is Sheila, and I've been a nurse for 26 years.
Hi, my name is Andrea, and I've been a nurse for about 3 years now.
I really welcome the opportunity to come here today and talk about nursing because even after 26 years of doing it, I totally enjoy it, and I have never looked back after choosing that career path. So I hope that once you've heard what we have to say, that will help you in your decision making. I didn't come to the decision of becoming a nurse easily. It didn't come quickly for me. I started off in a variety of different job settings before landing into this one. We're going to share with you a few things about nursing just so that you get a handle on what we're all about. So to start off, we're going to do Nursing 101, so a bit of a broad perspective about what nursing is all about, a typical working day highlighting personal experiences, what drew us to nursing, some of the prerequisites for nursing, and pros and cons. So there's three main areas of care in nursing. There's promoting health and preventing illness. This is the field of nursing that I have spent most of my career in. It's called public health. There's also restoring health and maintenance of function, physical, emotional, mental, and spiritual.
And there is also the end-of-life care. In essence, nursing has become a holistic practice. We like to look at socioeconomic status, education, and other factors to direct us in our nursing care.
When we look at public health, we look at upstream health. So we look at potential health concerns and the community, and we try to intervene before the issues become reality. So, for example, bringing people in to teach nutrition and a healthy lifestyle to try and prevent chronic illnesses like diabetes and chronic heart conditions. And another example would be things in terms of trying to prevent spread of disease. Street workers are supplied with condoms, so condoms are given out freely in the community, as well as needles for people that are IV drug users to try and prevent sexually transmitted disease as well as other infections.
All right, so restoring health, this is my field of expertise so far. We work in the hospital and in the community when caring for someone who is sick. Often people will never achieve perfect health again if they've been diagnosed with a new chronic illness, such as diabetes or sometimes cancer or heart disease. But it is our job to try and teach them and guide them to be able to live the best life that they can from today on. There's also end-of-life care. This is when a person will reach their last phase of life. In this picture, it's an elderly lady, but the reality is that not everyone is as old as this lady here. Often it's younger people, and it's our job as a nurse to support the patient and the family through grief and accepting the reality of the situation. It's also our job to help with the patient during symptom management and pain management. For example, when there's someone dying of cancer, often they have lots of pain. So we're very focused on keeping the patient comfortable for their last few days or their last little bit here.
I'm going to take over just for a little bit. So when I first started post-high school, I went into university in the Faculty of Arts. And I was in the Faculty of Arts for a year before I went into the Faculty of Education. And I was there for probably about 2 months. I quit just about after they told me I was ready to start teaching a class, and I felt so overwhelmed at what I was facing that I just decided teaching was not for me. So what I did was I became a nurse's aide, and I went through training at what is now Riverview Health Center, back in the days when they offered training in hospital. I was a nurse's aide for just over a year before I went into the Grace Hospital, and at that point the Grace Hospital was providing education to become a diploma nurse. That was a 2-year program. As a nurse's aide, I would say that it provided me with such an incredible wealth of knowledge. So if any of you are thinking about nursing, not quite sure, that's certainly an opportunity or a venue that you can choose to go through to get a feel of what nursing is all about. Because in that field, you'll be able to experience what shift work feels like for you. You also get to experience what it's like to be hands-on care with people. Learning about how to talk to people, how to help people through whatever parts of life they're in, discussing with families where people are at. It really is, for me, it was a good opportunity to learn sort of the first step into nursing. When I became a diploma nurse, or a registered nurse with a diploma, I worked for a little while in geriatrics, which is looking after older folks, and I worked on a rehab unit. So those would be generally people that had experienced strokes or broken hips, that kind of thing. I moved up north about 3 years, after becoming a nurse, and I moved to Gillam, Manitoba, where I had an opportunity to work in a very remote community hospital. This was an excellent opportunity for me, and if any of you are considering nursing, this would be great to get your feet wet, because boy, you learn on the run. So first I started at the community hospital and then went into public health. In public health, part of my role was to fly into a small community once a week. So in that small community, the majority of the population was of Aboriginal descent. So this really in my life was the first time that I'd had an opportunity to work in a community of First Nations. And I had just a wealth of knowledge come out of that, from being rather intimidated to just really, really enjoying that population of people. So it was really a great experience for me. What I learned in public health and home care was that when you're working in the hospital, you've got control of your environment. When you go into somebody's home, they've got control of the environment. But it also provides you with a window of opportunity to see how people live and the types of barriers that they sometimes have to deal with. So in providing nursing care in the community, it's also taking really sincere consideration of the types of barriers that they may be experiencing on a day-to-day basis. When I moved back down to Winnipeg, I continued to work in public health, but as an immunization nurse. You need to have a degree in nursing in order to be a public health nurse, so I went back to school. As an adult going back to school, I can say without question that it was one of the best experiences of my life. It gave me an opportunity to witness and experience some of the other experiences that other nurses had had in their career. And going in as an adult learner was really a great opportunity. When you become a nurse, you don't just end your education when you graduate and get that degree put into your hand. It's considered to be a lifelong education opportunity. Once I got my degree, I became a travel health nurse, and that is working under the umbrella of public health. So travel health is really a specific field in public health that helps people when they're traveling to go as prepared as they can be in terms of immunizations to prevent disease, as well as awareness of other infections and risks that people may have while they're traveling. For a while, I also worked in Point Douglas, which is part of the core area of the city of Winnipeg. For some of you, you may not be aware of this, but depending on where you live, even within the city of Winnipeg, can determine your length of age, which I found rather amazing. If you were raised and live in the south end of the city, your life expectancy is actually 17 years more than what somebody lives in Point Douglas. Sorry, Andrea. I also wanted to include with that is the idea that when you look at nursing in the community, you don't just look at what the people are about. You consider the community, their socioeconomics, what kind of money they bring into the home, and what kind of skills they have.
All right, I'd like to talk a little bit about my nursing experience so far. I wasn't sure going into university where I wanted to take my career. I knew that I wanted to work with people. I knew that I wanted to be science-based. I knew I wanted something that would offer a lot of excitement. I spent 2 years in University 1 working on the prerequisites. for both physiotherapy, I believe, and nursing. And then after 2 years, decided that I would apply for nursing, and I got in. After my second year in the faculty, I was qualified to become a healthcare aide, and I decided to work at the Grace Hospice, which is a place for people at the end of their lives. It's a palliative setting. I worked with young and old people there, and worked with lots of people of different cultures and religion. I got to see what was important to people at the end of their life, giving them dignity at the end of their life. My day-to-day job there was basically getting them up, getting them dressed, cleaning them, helping them with just different activities, and spending time and getting to know them. I carry with me in memory a lot of the people that I cared for, and it was very, very influential. When I graduated, I did my senior practicum for 3 months on a medical unit called 5E. It's in St. Boniface. It's a fairly acute ward. It's usually where people come from the intensive care unit or from the emergency. And if they come to us and they're too sick, they go directly to the intensive care. So it's kind of a middle ground. It's not really a rehab unit. So while I've been there for 3 years, I've been able to transition from a student to becoming more independent and confident with my skills. I'm now in a role model setting, and I'm able to take students under my wing and kind of show them around, which I find really rewarding. I really like that. My day-to-day work varies. Usually I have 4 to 5 patients. I need to know why they're there. I need to know what their barriers for discharge are, why can't they go home, what they need to do to get better. I need to focus on if their issues are mobility or oxygen requirements. I need to do exercise with them to make them stronger so they can walk or so they can breathe without oxygen. I also need to do a physical assessment. I need to know them inside and out. I need to know if there's been any changes in or a decline or improvement either way. I need to be able to report it to a doctor so that we can change our plan for them. I also need to complete treatments, which is more I like it. It's more hands-on. This includes blood administration, medication administration, often dressing changes that can be a little gory, which I also like. It always keeps you moving. I really like it. So every day is often similar, but even the people who have the same illness, let's say heart failure, for example, usually everyone has their independent other issues. So no one is alike. Everyone has different comorbidities that keep you always thinking. I work with a lot of other staff members, including dietitians, physiotherapists, occupational health, and as a team, we work together and we try and make the best opportunities for the patients to go home.
This year, just recently, we had in the Canadian Nurse magazine an article that talked about different blogs. So we threw this in here for folks that are interested in looking at some blogs that talk about people's nursing experience. So there's nothing in those blogs that would identify patients, but it certainly gives you a very good opportunity to see what nursing is like from day to day. If you want to have a look at those later, you can certainly get the numbers down. So a quick discussion about the statistics. I called up the College of Registered Nurses of Manitoba, and what they told me was that there are 13,000 nurses registered this year for nursing. That includes nurses that are currently registered as well as graduate nurses. And the ratios are slowly starting to change, which I'm very excited about. So for all you gentlemen out there, things are starting to improve in terms of nursing and numbers of men. So we're still fairly female-dominated, 92.4% female, 7.6% male. But just 2 years ago, it was 6.4% male. So we are slowly working up to a little bit better numbers in terms of male-female ratios. The average age of a nurse is also fairly significant, anywhere from 13 to 20% over the age of 41. So you've got pretty good odds for you. This means that a female-dominated profession is still the case for nursing, but more and more men are finding an interest. And we're not quite sure why that is, maybe because there's a lot of women there. But the other thing is that it may be that nursing, particularly in the hospital, has become very technical. And there's quite a lot of interest in that for men, getting into machines and all of that kind of stuff. So the face of nursing is slowly evolving from being like real bedside to being a little bit more. So a lot of men are really finding an interest in that. It also means that more than half the nurses in Manitoba are over the age of 41, and more than 20% are over the age of 55. So new nurses will almost for sure have job security, if that's an issue for you, because a lot of nurses are looking forward to retirement in the very near future. In terms of prerequisites for nursing, they differ depending on where you want to go to school. So I would recommend that you discuss this with whatever faculty of nursing, maybe out of University of Manitoba, Red River Community College, University of Brandon. If you want to stay in Manitoba, have a look at what those prerequisites are so that you can go in prepared. As a prerequisite, for sure, you need to have certain immunizations as well as tuberculosis testing. And one of the roles that we do in travel health is provide that service. You have to pay for that service, so just so that you're aware ahead of time. And we do a review of all your immunizations and provide testing for tuberculosis. So even if somebody came back with a positive tuberculosis test, it does not mean that you would not be able to go into nursing, just that we would have to have further discussions with you. So that wouldn't deter anybody.
Another prerequisite to get into the Faculty of Nursing that is absolutely mandatory is a criminal record check and the child abuse registry. All right, the pros of nursing. And many of the reasons why I personally became a nurse, I'm a little more practical. I chose nursing because I like to work in different environments. We're not limited to the hospital. And for my mom, as an example, was able to work up north in different community settings. Another advantage is that it's rewarding, making a difference in someone's life. I've met many, many people, some famous athletes, musicians, and artists, and I've got to hear so many cool stories and live vicariously through them.
So even though it's rewarding for a client to actually, or a patient to get better, it's also rewarding for us to experience some of their life stories. The
money and benefits are very good. Definitely a reason why I chose nursing. I wanted to have some job security and financial security. For a nurse out of grad, once you're done your grad school, the starting wage is $31. And additionally, you can have weekend and night premiums that over a period of time can really add up. The position, or nursing, is also a portable profession. If you wanted to go up north or into more remote communities, bonuses are also offered up north, so it is also a very, very nice bonus. Also the flexibility. I really am not a Monday to Friday kind of girl. I like a little bit of variety. So I do work every other weekend. That's not a very good part of it, but I do have often weekdays off, so it's nice to be able to get in for appointments and different things like that. You're able to trade shifts. This is for me in a hospital anyways. Able to trade shifts, so you can make holidays longer, extend them. And it's easy for travel and really good for parents with young children. It's easy to arrange your schedule around maybe your partners so that you can be at home with the children during the day.
Teamwork and independent work is also very nice. So, for example, with Andrea working on a unit, she works independently during the course of her day, but she's constantly in contact with other team members to provide the best of care for the clients that she has. I find this also in my field of work as a public health nurse, working in the community. We're out there on our own, but we work in cooperation and with other resources in the community.
A con can often be the paperwork, and the patient load at times can be overwhelming. Time management becomes very important, and working with the patients, you just have to be able to learn how to communicate better with them, and also be able to communicate better with the family. With time it comes, but at times it can be a little daunting.
Violence is definitely a part of a nurse's world. So 1 in 6 nurses report being bullied at work in a 1-year period of time. That's significant. So chances are very likely, even though I hate to admit it, that this will happen during the course of a nurse's career. 3 in 10 nurses state being physically assaulted by clients in a year. So chances are very likely that in the course of a career you will be assaulted. That doesn't sound very good, does it?
That being said, there's always resources for that problem. In a hospital setting, if a client is aggressive, you're not alone. You have a team behind you. And as far as bullying in the workplace, I really, as a new generation nurse, I think that I really, really, really encourage group effort, including people, not leaving anyone behind. So I hope that is changing in nursing. I think a lot of the nurses on my ward who are in and around my age, and new nurses, I think that everyone would say that they feel equal and valued, and I believe it's changing for the better. It does exist, though. Vicarious trauma. It's hard to go into a workplace and not be affected by the people you care for. I've dealt with, some really sad deaths in families, and unfortunately, it does go home with you at times. With that, though, you have to learn how to cope, and giving really good care is a very rewarding way to cope with it. Knowing you did the best you could, knowing that you gave the person the best opportunity possible is rewarding in itself. But it does go home with you, and it can wear on you at times.
Shift work can be very hard on a person's body. Life expectancy decreases. And sometimes it's kind of stinky. But if you're interested, you're wanted, and you will be welcomed. Thank you.
Thank you.